year, we keep hearing about different types of cancer, but there's a particular cancer that affects women, and that is the cervical cancer. This deadly disease is one that affects women all over the world, and 1 out of 3 women are going to die from cervical cancer. Now, how do you help yourself or prevent yourself from dying from this deadly disease? Early detection is the key. In this video today, we are going to be talking about 10 early signs of cervical cancer you should not ignore. Hi there, my name is Rachel from The Healthy Woman, and today we are looking at the early symptoms of cervical cancer. Studies have shown that 490,000 women are infected with cervical cancer every year, with 290,000 of the infected people dying from this disease. You might be wondering, saying, oh, but I thought it's hereditary, is this, is that. Yes, it is hereditary, but there are other factors that can increase your risk and your chances of getting infected with cervical cancer. Just like every other cancer, they tell you early detection is key to survival. It is the same thing that applies to cervical cancer. But then a lot of women have these symptoms early, but they choose to ignore it because they don't know that those are the symptoms of cervical cancer. By the time they're getting to the hospital, the cancer cell has grown and it's almost impossible to stop the growth. With that in mind, let's look at the 10 early signs of cervical cancer that no woman should ignore. Let's get right into it. The first symptom I'm going to be talking about today is the lower back pain. So if you are a woman and you suddenly start noticing that your back is aching, every time you bend down to pick something, you're walking, you're lying down, every time you feel your back, the lower part of your back hurting, you need to check what the problem could be, because this is one of the early signs of cervical cancer. It's better you go to the hospital, you are tested, and you are told, oh no, everything is fine out there, you don't have issues, then you ignore it, and then 5 months down the line, you are in so much pain, and then they're telling you, oh, but did you not notice this and that? You want to prevent such from happening. So if you have backache that you cannot explain, you are taking medications, but you can still feel the ache, observe yourself. Are there other signs, other things that is happening that are not exactly explainable? Then this could just be your early sign of cervical cancer. You want to check that out. The next symptom I'm going to be talking about is the leg pain. Now, the leg pain comes after every other symptom. So you might not notice that initially. So typically, before you notice the leg ache, you have other symptoms, cervical pain, you have backache, you have all sorts of pain that you might have ignored until it gets to the point where your leg is now aching. At this point, the cancer cells have started to develop, they've grown, and it's beginning to affect other parts of your body. So you want to look out for other symptoms I'm going to mention aside from the leg ache. Now let's look at the next symptom. The next symptom common with people who have cervical cancer is the pelvic pain. The pelvic pain is really a pain just below your abdomen, like your lower part of your tummy. It usually happens when the cancer cell has grown and it has taken over that part of your body. They tend to start feeling ache. Now, these are some of the symptoms, but not some of the early symptoms. There are other symptoms that you notice before the cancer cells have gone full-blown that would help you prevent getting to the stage where the doctors are telling you, oh, there is not really much we can do about this and that. Aside from the pelvic pain, the next early symptom is loss of appetite. So if you are the kind of person who has a large appetite, who used to eat a lot before, who likes food, like me, and then suddenly you realize that you don't want to eat anymore. When you get food, you just eat very little, and you don't just have the urge to eat, you don't have the appetite to eat, and you're not feeling sick, there's nothing you can attribute to the loss of appetite, then it's time for you to check yourself. That is one of the early symptoms of cervical cancer. The next one is weight loss, unexplainable weight loss. Well, this could be attributed to your loss of appetite, because if you're the kind of person who used to eat a lot before, and suddenly you lose appetite, you don't have the urge to eat, it will affect your weight directly, and then you realize you start to lose weight. But if it's sudden, you're just losing weight, you cannot explain, you used to be 120 pounds, suddenly you are at 80 pounds, you're not working out, you're not doing anything to lose the weight, it's time for you to get tested. It's better to be safe than to be sorry. It's better you go to the hospital, get checked for cervical cancer, and you are told, oh, you're fine, you're free. There's nothing like that. And then you say, okay, so why am I losing weight? And then you start to dig into other things. Remember this. The next early symptom of cervical cancer that you do not want to ignore is abnormal vaginal discharge. It's normal for every woman to have discharge. It's quite normal because it's the way for the vagina to clean itself. Now, if suddenly you start noticing that your discharge is getting more than it used to be, or it's accompanied with blood, you need to get tested immediately. Because abnormal vaginal discharge is a way of your body to find you that something is wrong, Now, if you ignore these symptoms, it might be dangerous for your health. Because you might feel like, oh, it's just discharge, it will clear up by itself. I see a little bit of blood, but it's nothing serious. I don't feel pain, I don't feel this, I don't feel that. You want to get tested for cervical cancer. Once you notice you're having abnormal vaginal discharge or discharge accompanied with blood. Aside from a discharge accompanied with blood, if you notice that your vaginal discharge is having a funny smell, because the truth is, everybody's vagina has a distinct smell. Your cookie doesn't smell like flour. Everybody has a distinct smell that is unique to them. But when you start to notice that your cookie is having excess discharge, is having blood in there, or the discharge is beginning to smell funny, darling, it's time for you to get tested for cervical cancer. The next early symptom of cervical cancer that you do not want to ignore is heavier and longer menstrual period. Now, typically, the average woman's period lasts between 3 to 7 days. If usually your regular period is 5 days and it's not so heavy, it's just normal, or it's a bit heavy but not so heavy, and then you start to notice that your period is becoming so heavy, instead of the 5 days you usually do, now you're doing 15 days, 8 days, 10 days, and it's consistent, then something is definitely wrong. Because the body usually gives us signs that when something is wrong, but we tend to ignore it and say, oh, it will correct itself, oh, it's just hormonal imbalance, oh, it's this, oh, it's that, and then we'll make excuses for why something is wrong. But the truth is, it's better you get tested. I keep hammering on this point. It's better as a woman, you get tested for cervical cancer and you are told that, oh, there's nothing wrong with you, you're fine. It's better than you ignore all symptoms until you can't ignore it anymore. So if you notice that you're having heavier periods that last longer than they used to, and it's consistent for like 2-3 months, it's time for you to take yourself to the hospital and get tested for cervical cancer. The next early symptom of cervical cancer that you should not ignore is pain during intercourse. Usually, intercourse is supposed to be pleasurable. You're supposed to enjoy it. It's not supposed to be painful. But if suddenly you start to feel pain during intercourse, every time you have sex, you're feeling pain, you don't want to do it because the pain is unbearable. In fact, you shouldn't even feel pain at all. So if you notice that you're beginning to feel pain during intercourse, it's time to get tested. It's time to get tested. That might be your only sign or only symptom to detect cervical cancer. So when next you're having the do and you're going at it vigorously, and you start to feel ache, and you're like, oh, this is strange, this is new. I usually don't feel this kind of pain during or after. You should get yourself tested. Now, the cause of the pain during intercourse is due to the growth of the cancerous cells around the reproductive organ. Obviously, when you are at it, your reproductive organ is what you're using for the do. So, with the growth of cancer cells around that area, you start to feel ache or pain during intercourse. The next symptom that no woman should ignore is older women who are at menopause suddenly having vaginal bleeding. Like, oh, I've hit menopause, I stopped bleeding, I can't have children anymore, and then suddenly, now, you start to see periods. And then you start to wonder, what's happening? Am I fertile again? Can I now start bearing children? Or you start thinking of different things. That could be your only symptom to detect cervical cancer. So if you are above 50 and you have stopped menstruating, but then suddenly your period is back, or suddenly you start to bleed, then you should see your doctor. This could be a sign of cervical cancer. The next symptom you should not ignore as a woman is if you are having bleeding in between periods. So let me give you an example. You usually have your cycle is a 28-day cycle. So after 28 days, I'm seeing my period next. But then in between the 28 days, you start to bleed, and you didn't take any contraceptive or any hormonal drug that should affect your period, and then you just notice that 10 days later you're bleeding again, or 14 days later you're bleeding again. This could be your sign to go to the hospital and get yourself checked, because these are some of the early symptoms of cervical cancer that people tend to ignore. The regular woman's cycle is usually between 21 to 35 days. So if yours falls anywhere between 21 to 35 days, you're good. Now, if you notice that you are exhibiting any of the symptoms that I have mentioned, ensure you take yourself to the hospital. Ensure you speak to your doctor. Because, like I have said again in this video the 100th time, it's better for you to go to the hospital and you are checked for cervical cancer and you are told that, oh, you're fine, there's nothing wrong with you. And then you start to wonder, okay, what is wrong? It could just be due to hormonal imbalance, but it's better you check for cervical cancer first and then go to the route of checking for hormonal imbalance. Also, as a woman, it's advisable that you carry out pap smear test, which is a test used in detecting cervical cancer at least once in every 3 years. So you, who is watching this video, it's time for you to get tested. Thankfully, medicine keeps advancing every day. Right now, there's a vaccine for cervical cancer. But you have to get tested first, which means you have to do a pap smear test first. If your result comes out negative, then you start taking the vaccine. It's always taken in 3 doses. The vaccine, just like every other vaccine, helps prevent you from getting cervical cancer. Now, if you haven't gotten the vaccine, or you say, oh, I don't think I need the vaccine, ensure you do a pap smear test at least once in every 3 years. That way, you prevent yourself from becoming a victim of cervical cancer. Cancer generally is bad. Cancer generally is bad because the effects of cancer, a lot of the time people fight it and then it comes back, fight it, it comes back. So it's better to even prevent yourself from getting affected at all with it. And that are the 10 early signs of cervical cancer you should not ignore. If you like this video so far, remember to hit that like button and subscribe to my channel to join the family. Also, turn on the post notification bell so that YouTube will personally notify you every time I drop a video similar to this. Lastly, leave me a comment in the comment section letting me know of any suggestions or questions you might have concerning this issue. And with that, I will see you in my next video. But remember, your health is your wealth.